Dr. Ali Abdallah Ali, doctor in dental surgery. I'm from Isnan Turkish Clinic. I would like today to talk about tooth sensitivity. Most people complain a lot about sensitivity of the teeth when they take water, cold water, hot fluids, or sometimes just like they breathe in air, they feel a sensitivity in the teeth, and most of them don't know the cause. So what exactly causes it? Sometimes it can be mechanical, sometimes it can be dissolving of the enamel due to the fluids we take. When, like example, you take most fluids which are carbonic, the cokes, those with too much acidic content, or maybe you take the vinegars, or maybe citric fluids, these all, they contain a lot of acid that dissolves the enamel. Now when the enamel is dissolved, what happens is there is exposition of the dentine, and when the dentine is exposed, it starts receiving the stimulus from all types of foods, drinks that you take. But also in brushing, sometimes when you brush teeth, the way you brush teeth, how do you brush teeth? Incorrect brushing techniques, like someone instead of brushing going circular motion or going up and down motion, some people go horizontal and use a lot of force, thinking that using a lot of force can take out all the darkness and make the teeth white. So in this process, someone ends up making cavities. The gum resides, falls down, then the roots is exposed, and what happens is the more you continue brushing teeth, you keep on trying to make the erosion. There is two mechanical force that happens in between there. What happens is that the rubbing between the teeth and the toothbrush causes friction, and in it there is wearing out of the surface of the teeth, and this will lead to exposition of the dentine and sometimes of the roots or the nerves which are in the roots, and this will give the problem of sensitivity whenever you take cold things, or just even normal lifestyle like just breathing, talking can be difficult sometimes in cold weather because of that receiving the response you get from the nerves. But how do you prevent this? Most of the ways we try, when someone comes for the checkup, we try to give the education on how to protect their teeth. We always try to teach them the best way to brush their teeth and what happens if you don't brush the correct way. Then we try to advise them to reduce in the contents they take, the fluids and the foods which are more citric fruits, the oranges, the pineapples which aren't very ripe, the mangoes, raw mangoes. So all those, or maybe the drinks, the cokes, those Fantas, the vinegars. Sometimes we advise them to minimize, or if possible, the fruits should take them while they're ripe. Also, the taking of the alcohol, these whisks, the strong liquid, they can also lead the problem. So we try them to minimize to the maximum, because if not, we advise them to use the straw. Why the straw? The straw to minimize the contact which touches the teeth, because it comes in the mouth, the tongue goes into the throat down. Instead of taking it by the mouth, begins with the front teeth, or the teeth get affected by the content you take in. But also, when someone has that problem, we always try to advise them, if it's a simple, minor cavity formed, maybe under recession, the gum falls and there is that abrasions, we try to do a filling, simple filling, to stop that contact between the inside and the outside. But if it's too deep, we always advise the patient to do root canal, to remove the sensitivity. Then from there, we advise to rebuild the teeth well. But if we see like still is good, but there is sensitivity, we always advise the patient to crown the teeth. Why crown? Crown the teeth to prevent the contact of the food with the enamel, and the other tissue down. Because when you try to prepare the teeth well and cover it on top, you're always trying to cut out the connection between the two, the food and the teeth. But still, if we see like the sensitivity is too little, And we have already advised the patient on how to prevent the problem to increase, to continue. We always try to advise the patient to use sensitive jellies like this. This is a Miradont jelly. This is a sensitive jelly. When you use this jelly, what happens is it helps to release some chemical which go and try to paralyze the nerves, making it not to be sensitive. And that helps to reduce the response of the stimulus. But also, we always advise the patient to use mouthwashes. And every time when they brush and whenever they eat, they should rinse with enough water. Why rinse with enough water? They should rinse with enough water because if you leave the contact the mouth, it will attract bacteria. Not only the bacteria, the presence of the content in the mouth will lead to erosion of the tooth. So when you try to rinse well with enough water, you try to take out the remaining contents, the fluid you took on the teeth, and this will help to prevent the problem to continue. Thank you very much.